Hello everyone, and thank you so much for joining me today for this short session which I hope will help release any low back discomfort or any pain that you might be having at the moment, or you have it intermittently in everyday life. And it just gives you a little tool in your toolbox, a little bit of do-it-yourself release work, which doesn't take very long, and we don't really need any specialist equipment either. What I'm going to use today, I've got a selection of 3 types of balls here. So the kindest ones I've got are my red prickle balls. So I don't know if you can see, they've got a little bit of give in them and they're not terribly spiky. So they're quite kind and forgiving, but still give you a really, really nice release. And then just sort of moving up, I haven't got tennis balls, but pretend that these are tennis balls. So they haven't got the spikes, obviously, and they're a little bit firmer. So they would go in a little bit deeper into the soft tissue. And then last but not least today, I've got these guys here that are a little bit smaller, but they're very, very firm and quite hard. There's really no give in them whatsoever. So they're going to go in the deepest in the areas that we're going to be massaging out. So when we come to do the low back massage, we're looking for the balls to be placed somewhere in the space here between your bones. So the lowest ribs there, and the top of your pelvic rim. Which way around's the best way for me to do that? The top of the pelvic rim there, and the sides of your spine. So really what we don't want is for the balls to ever be placed on the bones themselves. So we're just sort of looking for somewhere in between the skeleton and into the sort of soft tissue itself. So we're going to be doing some massage today for the lower back, the lumbar spine region, but we're going to actually start massaging across the back of the pelvis along the line of the piriformis muscle. Just before we get started, one thing I would ask, if you've got any known pathology in your low back, it might be worth you checking with your clinician or your low back pain practitioner, first of all, just to give you the go-ahead that it will be okay for you to do this session. Okay, let's get started. So, lying down on your back, body nice and square to the ceiling, just gently pushing through the feet, engage your core, and then just lift your bottom up and place the balls underneath the back of your buttocks. And then just allowing your body to deepen into the balls. And you can either just stay on one spot for somewhere between 30 seconds up to 2 minutes, or you can just stay and then move the balls to a slightly different area across the back of the buttocks there. And if you start to feel a sore point, chances are you've hit a trigger point. And when you find one of those, if you just stay with that trigger point, breathing in and breathing out. And again, breathing in and breathing out. Somewhere between 30 seconds and 2 minutes on that trigger point should be sufficient to release it. But if you feel any discomfort or pain is getting worse, then please stop. It's just not suitable to do today. And then the other thing that you can do, rather than stay pretty static, moving slowly across the back of the buttocks there, is just to place the balls so they're nice and level underneath the back of the pelvis, sort of really into the fleshy part so you're not directly on any bone. And then just start to gently massage across. So I'm just letting my hips move, my feet are a little bit active there, just that little bit of pressing down through my feet gives me a little bit more purchase onto the balls there. And just really sort of playing around with the back of your own pelvis there, because we might all have trigger points in different areas. One side might be absolutely fine, whereas the other side might feel quite sore. And we're just sort of moving just from that outside edge of the sacrum. So again, we're not directly onto the sacrum itself, out towards the trochanter head. So just separating the balls a little bit further apart there. And then again, massaging across. And then if you feel one side is definitely more tender than the other, what you can then do is to just turn the body and just lean into either the right or the left side. And again, either stay on the point, breathing in and breathing out and releasing through the trigger point, or you can stay on one side there and massage across the fascia, across the muscle groups. Just observing. Sometimes it's just like looking for a needle in a haystack and everything feels really, really comfortable. And then all of a sudden it's, ouch, got it now. And then you could try and go over to the other side. And to go a little bit deeper, there are a couple of things you could do. But then from here, choosing my spot, I could just cross one ankle over the other side and then float my knee up as if I'm doing a piriformis stretch, and then do the same thing again. So either holding it there, or I could just turn and do a little bit of rocking and rolling there. So massaging across the muscle fibers. And just taking your own time playing around with the positioning of the balls. And then you can just rest down for a moment, see how that feels. So the other thing I could have done, rather than stay on the same balls and just go into the piriformis type stretch, I could have picked up my harder balls here. Because they're quite hard and quite solid, then that would have gone deeper into the muscle. So I play around with that as well. So for going into the low back, I'm going to change my equipment now. So I'm going to put one ball underneath my left buttock there, and then the other ball into that lower back soft tissue area that I showed earlier on the skeleton. So again, we don't want to be directly on the top of the pelvic, but back of the pelvic line there, and we definitely don't want to be on the spine itself. So it's just playing around with, where do I need to be? And I like to use the two balls because it just helps keep my pelvis a little bit more even, rather than have my left buttock on the floor and the right ball underneath in that gap between the base of the ribs and the pelvis, which I know with my own body would just serve to make my rib cage pop up to the ceiling. So by having the support of the ball underneath my left buttock, I can just let my rib cage sink down. And straight away, just holding it there, I can really feel lots of trigger points in the right side of my lower back. So again, I can choose to just stay here and breathe in. Almost like I'm breathing into it and out from it. Couple of breaths. And the idea is just by staying on those trigger points for anything up to 2 minutes, the trigger points will just release and let go. So any discomfort you might have started with just melts away like butter or ice melting in the sunshine. And then again, moving it to a different position, checking I'm not on those spinous processes. And then you could also choose to massage across. So just being really mindful that you're not on your bottom rib. So it's just finding somewhere in that gap between the base of the ribs, the lateral border of the spine, and then again moving the balls, slightly different area. So you might find at certain levels it feels absolutely fine and there's no trigger points going on there or no discomfort. And then sometimes we just move it a quarter of an inch higher or lower or go a little bit wider out towards the outside edge of the back, and then it can very, very quickly become a different story. So that was a horizontal massage. And what's rather nice to do as well is to roll up and down the muscles. So again, on the flesh somewhere, and I'm just sort of using a little bit of my arms. I'm propelling away with my feet, and then really slowly massaging up and down the length of those low back muscles. And it's just playing around really. Where do you want your feet? Where do you want your pelvis? And then I'm going to change over sides. Of course, you can do this at your own leisure. So this time the ball is underneath my right buttock and the other ball into the left side of my back there. And I'll start with the horizontal rolling across, nice and slowly, to give that fascia enough time to be teased out rather than too quick sort of disco dance type movement there. And again, it can feel really, really different on one side of the lower back compared to the other. So just observing, being really curious about the difference between maybe the right and left side of the spine. And then a little bit of the vertical massage. So I'm starting sort of quite low down, just above the back of the pelvis there. And I guess I'm only really moving up and down about an inch vertically. And then I can just sort of move the ball a tiny bit higher and then move up another notch or an inch. And then I can take it a little bit wider if I wish. And then I've done this in reverse, so now just looking for a static point, and maybe I've already managed to tease away any of those trigger points and got rid of them. And then again, I haven't. I found one. So breathing, just being really still now. So my pubic bone's slightly higher than my hip bones. I'm not in a neutral pelvis there. It's just like I'm letting my back just sort of relax like a hammock there. So I'm breathing into that trigger point and almost like I'm breathing out from it. And with that breathing, I can just feel, especially with the out breath for me, it just goes a little bit deeper into that soft tissue. So for the first couple, I definitely felt the trigger sort of point discomfort turn up on the dial a little bit, but what have I done? About 3 or 4 breaths, and they've completely dissipated now. I just take the balls away, come back to my start position. And I hope you're feeling the same. Even though that was a very short sequence, I can already feel that I've got more flesh on the mat. And I haven't done that by tucking my pelvis under and imprinted. I'm just back into my neutral pelvis. But I've definitely got a little bit of contact with my flesh now into my mat, which tells me that I've managed to release those areas in my low back that may have been causing tightness and in turn discomfort. So I hope that was useful for you today. Another video, what I will look at is the thoracic spine, and also releasing across the front of the chest, just in case the problem might be to do with a little bit higher up the spine as well. And quite often most of us get stuck in this sort of flex position anyway, so it's really, really nice work to do. So hope to see you soon, and thank you very much for joining me today. Take care and lots of love to everybody. Bye-bye. Hello everyone, and thank you so much for joining me today for this very short low back release